Hello and welcome to my presentation, Understanding Panic Disorder from a Physiological and Clinical Perspective Lens. Thank you for your time in watching. So what is panic disorder? Panic disorder is a mental health condition characterized by recurrent unexpected panic attacks and persistent worry about having additional attacks. Oftentimes, someone dealing with panic disorder has panic attacks, is triggered, the PNS works in a dysregulated way, and then they're triggered again by an external stimuli or an intrinsic factor. Panic attacks involve sudden surges of intense fear or discomfort. They can also be accompanied by somatic symptoms such as dizziness, lightheadedness, heart palpitations, feeling of fight or flight response as well. The disorder can significantly impair daily functioning and is often comorbid with other mental health disorders. Oftentimes, patients having depression, generalized anxiety disorder, perhaps OCD, it's not uncommon for them to potentially have panic disorder, especially because of the cyclical pattern that exists in many people struggling with the disorder. So there are a few physiological processes involved in someone who is diagnosed with panic disorder or who may be exhibiting symptoms of panic disorder. The first one we'll look at is somatic perspective. So someone who has panic disorder might often be in a heightened autonomic arousal state. Now this means they can have a variety of physiological symptoms. Maybe they have rapid heartbeat, trembling, dizziness, lightheadedness, potentially even shortness of breath and sweating. The next physiological process we'll look at is the SNS, or sympathetic nervous system. This is our fight or flight response, governed by the SNS. So it's activated in individuals who struggle with panic disorder or who have frequent panic attacks. This can often cause an exaggerated physiological response, even in the absence of real danger. Sometimes they can be triggered by going to a supermarket or the airport or different environments that can trigger their nervous system. The last one we'll look at for this slide is the chronic stress response. So prolonged heightened states for the SNS may lead to dysregulation of the nervous system. And this can impair the body's natural ability to return to a more calm homeostasis and is critical in those dealing with panic disorder. So there's this really interesting dance that happens between the SNS and the PNS, so the sympathetic nervous system and the parasympathetic nervous system. And the SNS is responsible for the body's immediate response to fight or flight feelings. In panic disorder, the SNS becomes so overactive, leading to exaggerated physiological responses that we talked about in the previous slide. The PNS, or the parasympathetic nervous system, comes in after such physiological events and tries to calm down the body. In panic disorder, though, the PNS may be sluggish or not as efficient in calming down the body and subsequently the physiological responses that come with panic attacks or the heightened SNS state. This often leads to dysregulation as there's a chronic imbalance between the SNS and PNS, and this may contribute to persistent panic disorder and kind of the cyclical event that occurs in those who struggle with panic disorder. Therefore, understanding the role of SNS and PNS in each client is crucial to being able to help treat them effectively and efficiently. So So the fight, flight, and freeze response is really important in those who experience panic disorder. So our fight involves preparing the body for defense, right? It has muscle tension, increased heart rate perhaps, and the response can often be overactive in people who struggle with panic disorder. We also have the flight response. Here the body becomes ready to escape. Physiological responses can include, similarly to what we talked about earlier, shallow breathing, maybe a higher heart rate, heightened awareness of the environment and surroundings. And lastly is freeze, right? So an individual may experience such disassociation, such an uncomfortable feeling. They might become so overwhelmed they feel stuck. And a response that might occur is this overwhelming fear and becoming completely frozen, unable to move through maybe the test they're completing or their day. And all three of these are natural responses in someone who is struggling with panic disorder, but these responses may be triggered by environmental cues or even internal bodily sensations, such as the somatic feelings we spoke about earlier, and they can be misrepresented as extremely threatening. So there are quite a few potential causes for panic disorder. The first we'll look at is genetic factors. So quite a large part of the population, actually 40%, is at risk of developing panic disorder if they have a genetic predisposition. The second is environmental stressors. So stressful life events, PTSD, traumatic events, chronic stress, even chronic illness can serve as triggers for the onset of panic disorders, truly at any age in one's life. There's also cognitive factors. So individuals with maladaptive thought patterns, catastrophic thinking the worst outcome in any possible scenario, and we're prone to misinterpreting bodily sensations and developing panic attacks, which also can be quite cyclical. There's also neurobiological factors. Dysregulation in the amygdala and prefrontal cortex can disturb fear processing and may contribute to heightened vulnerability around panic attacks. And again, kind of continue this era of cyclical panic attacks and heightened awareness states. There are also quite a few comorbidities in panic disorder. So we'll often see clients struggling with other diseases or disorders, and they might coincide with panic disorder. Anxiety disorder is a prominent one. Panic disorder is often comorbid with generalized anxiety and social anxiety. Depression is also another one. A high percentage of individuals with panic disorder also experience major depressive disorder. Substance use disorder is another. Individuals may turn to alcohol or even SSRIs as a coping mechanism, which can exacerbate the disorder and the symptoms, unfortunately, if not taken in the correct dosage by psychiatrists or therapists licensed. There's also physical health conditions. Chronic stress and panic attacks are associated with an increased risk of cardiovascular diseases. And again, sometimes those who are dealing with such diseases can be more hyper aware of their body, and this kind of creates this cyclical hypertension and awareness about their body states. Now, how can we get relief from panic disorder or one struggling with panic disorder? Now, there are quite a few modalities and methodologies that are super beneficial and evidence-based. CBT helps individuals identify and change maladaptive thoughts and behaviors. And it can also include exposure therapy to reduce avoidance behavior. So by talking through these issues, finding more adaptive behavior and altering behavior and actions day in, day out can lead to great change for clients struggling with panic disorder. MBSR, mindful-based stress reduction, can also be super beneficial for those struggling with their somatic and mind-body component. MBSR teaches individuals to focus on the present moment experiences, including bodily sensations, in a non-judgmental way. This is really great for someone struggling with panic disorder because there often is this hyper sense of awareness in the moment and perceived threat when that might necessarily not be the case. This helps reduce physiological overreaction during panic attack. And if a client can feel this for prolonged periods frequently, they can train their body and their central nervous system and PNS to adapt to stimuli a little bit better and learn to be in that calmer, more present state, even in a situation that might have triggered them previously. But just that repeated behavior and coming back to a calm state can be super beneficial over a longer period of time. Interpersonal therapy, or IPT, can be really beneficial where panic disorder co-occurs with depression. IPT may be beneficial in addressing interpersonal triggers of anxiety. This is really, really good for those struggling with generalized anxiety disorder or depression. So one might be wondering, are there medications for panic disorder or for clients who are looking for some relief for their panic disorder? And the answer is yes. Selective serotonin reuptake inhibitors, or SSRIs, are a great first line of defense for pharmacological treatments in panic disorder. And next is benzodiazepines. This is medication like Xanax, and these are better and more well suited for short-term relief and high panic moments, but not good for prolonged usage. There are also some more medications that are beneficial for those struggling with panic disorder. Serotonin norepinephrine uptake inhibitors can be super beneficial. They can also be effective in treating outlying symptoms of panic disorder. Beta blockers can also be beneficial. They can be used to manage physical symptoms such as rapid heartbeat and shaking. There are also a multitude of modalities and therapeutic techniques for panic disorder for those looking for relief with medication and perhaps those who are not taking medication at this time. Cognitive restructuring is the first one we'll look at, and this is a segment of CBT. Cognitive restructuring helps individuals recognize and challenge irrational thoughts about danger and bodily sensations. There are also relaxation techniques. Progressive muscle relaxation and deep breathing exercises help activate PNS, or parasympathetic nervous system, reducing the intensity of panic symptoms and calming down that physiological response a little bit more. Things such as yoga and deep breathing, and perhaps somatic exercises with a therapist, and even EMDR has been shown to offer positive benefits in panic disorder. Also, mindfulness practices. In MBSR, clients learn to observe their bodily sensations without judgment. This is key as the client begins to learn how to come back to a homeostasis consistently on their own without judgment. This helps reduce fear of those sensations and decreases the likelihood of panic attacks to happen again or to have that cyclical nature. It's really retraining the mind and body to come back to a more calmer state, even in perhaps situations that normally would be a trigger. So learning what tools and methodologies work best for you or for your client, and implementing them on a consistent basis to see what works best. One might need more support and treatment as they go through their journey of being diagnosed or perhaps managing their symptoms in panic disorder. Social support is very important. This might be family or friends. This also could be peer groups, or even active groups or mindfulness groups that could help reduce isolation and anxiety. Maybe yoga groups, meditation groups, panic disorder groups. Working with your psychologist or psychiatrist to find these kinds of events and groups can be beneficial too. Also, panic disorder is a marathon, not a short sprint in terms of finding what works and reducing symptoms. Long-term maintenance is key here. Ongoing treatment or therapy or medication is often necessary to manage symptoms and prevent any form of relapse. Additionally, self-help strategies. I always think that being a good psychologist or therapist is being able to give your client the tools to get strong on their own, not telling them what to do and giving them a magic formula. You can advise them, but giving them the tools to find that strength within, and that's very important in those struggling with panic disorder. Psychoeducation, stress management, and regular mindfulness practice can be beneficial in long-term recovery. Cultural and demographic considerations in treatment. So there does need to be cultural sensitivity as a therapist or psychologist. Treatment approaches must be adapted to respect cultural differences, understanding where your client's coming from, understanding their culture, understanding how they view therapy and therapeutic modalities. There also has to be grace toward mental health strategies and coping strategies. Each culture is different. It is important to be educated and understand where your client is coming from and what might be causing or contributing or preventing them from getting the care they need. There might be fears around access to treatment. There can be disparities in access to mental health care based on socioeconomic or cultural factors, which should be addressed in treatment planning. This is really important when we're first meeting with clients and understanding their culture, their background, what they're looking for out of therapy, and what they're coming to therapy. And a really important tool we have is our assessment and rapport we build in the beginning with our clients. Also, tailoring interventions. For example, MBSR, which emphasizes self-awareness, may be more compatible with cultures that value meditation and mindfulness practices, and maybe less so with the different kind of cultures. So being really aware of the culture and the client that you are treating. Thank you for watching my presentation. Attached are my references, and thank you again.